Yes, the Lion's Den, maybe. I was volunteered for this. I guess this is obviously close to my heart at the moment, the changes in structures in veterinary medicine that are going on at quite a fast pace, and it's difficult to keep up with things. So I just thought I'd give you a few thoughts, really, on that change and what's happening and how that's going to impact and the dangers and the risks and the opportunities around that. So if you're of my vintage at all, you probably might have been inspired by this man, Alf White, and his fairy tales from Yorkshire about veterinary medicine. And I certainly was inspired by those books, and I dreamt of being a large animal veterinarian. But I turned out to be a small animal veterinarian. In fact, the last dean of the veterinary faculty in Liverpool, Malcolm Bennett, once introduced me to the chief veterinary officer, Nigel Gibbons, and said, "This is John, he's Professor of Small Animal Studies, so he's got the same role in society as a hairdresser." I thought that was great coming from Malcolm, because if you know Malcolm, he's never been near a hairdresser. But I kind of knew what Malcolm meant by that. But actually, as I've gone on in life, I've realised how important small animal medicine is to society and to people. But corporate practice is not just about small animal medicine now. And small animal practice, it's about large animal, it's about equine, it's about histopathology, it's about clinical pathology, it's about every part of practice. So there's a Google map. Thanks for the introduction, Mira. It does work in the UK. Although I did notice an error there, that Hector's practice in Stornoway doesn't appear on this map here. But there's about 5,500 practices in the UK. And it's not just the UK that is changing rapidly. Scandinavia and now Northern Europe is changing rapidly, and of course the United States. I drew this table up about a week ago, so it is out of date. But you can see from the numbers, these are the large groups that we have in the UK now. You can see from those numbers that approximately 32, probably 33% now of the UK veterinary practice market is in the hands of large groups. So this is not just clinics, this is laboratories, crematoria, out-of-hours services, of course, and online services to clients. And this is going to increase. Predictions are that in the next couple of years it'll be 50%. And maybe in 5 years' time, it'll be 70%. If you look at the optics market, which is often used as a predictor for what's going to happen in the veterinary sector, the optics market is around about 70-75% corporate. And they went through this process about 15 years ago. So you might think this is all terrible. I obviously stole this line from the great Spike Milligan on his gravestone there. And you know, there are a lot of people that feel bad about this. And I must admit, I felt a bit bad about it too, when I was sitting in academia thinking, what the hell is going on out there in veterinary practice land? And of course, we would all like to have this vision of veterinary utopia, and the corporates would like to paint that. Of course, no veterinary practice, no veterinary group is perfect. And these are very much work in progress, and the groups are learning as they go. Of course, ownership potential has been a major factor of working in veterinary practice for some people, and that's been the model that we've worked to for a long time. That independence. I remember doing a piece with BBC Panorama a few years ago, and the producer of Panorama, he said to me, "What do you think of vets as people?" He said, "because I meet lots of people in society, and vets strike me as fiercely independent people." And I think that's true, isn't it? And we don't like that feeling of loss of independence. It was a fragmented sector, though. We're working away in small practice groups, maybe individual clinics, and fragmentation has advantages, but it has disadvantages too. And it was very variable. I'm sure when you were seeing practice as a student and seeing practices as inspectors, maybe some of you are for the Royal College, you will see variability in standards. And that can be a good thing, but it can, at the lower end, it can be a worrying thing. And investment is variable, depending perhaps on the locality, depending perhaps on the time of life of the practice owners. But small practices and independent practices can be flexible. They can adapt, and they can change rapidly. And you often hear this advantage of it being like a family atmosphere. Clearly, They've never met my family. Loss of ownership potential is an issue, I think, for us to grapple with. And I think not all the corporate groups have an employment model. Some have a joint venture model where there is a shared ownership. But that loss of the ability to run and own a practice is of concern and is something that the corporates do debate. Loss of freedom. Well, is clinical freedom? Yeah, clinical freedom is a good thing. On the other hand, it's a bad thing. Actually, what we should be driving towards is evidence and best practice. And I think corporates, as large groups, do worry about that, and they debate it and they drive it. And it's the vets within those groups that are doing that. It's not the accountants doing that. And I think there is a bit of a myth that corporates are run by accountants and financial directors. Yes, of course, they're very talented financial directors, and they're very good at their jobs. But they do not drive clinical decision-making. It's the vets that are doing that. Exit strategy. So most independent vets hate the corporates until they want to sell their practice. Then they're their best friend. I might need an exit strategy at the end of this talk, obviously. But, of course, it is providing for a certain generation a very nice exit strategy. I think the corporates do provide structure and scale, and that can be very valuable. It's changing the relationship in the sector between the suppliers, the manufacturers, and practice. It was very much the manufacturers and the suppliers that had most of the cards before, and that's changing. That dynamic is changing. And minimum standards. I think, I sit on our clinical governance committee within our company, and I know all the other groups will have clinical governance committees, and we worry about that. And it's right that we worry about that. And we're trying to drive standards up and avoid banana skins and keep an eye on what's going on in our practices. So yesterday I met with the other senior vets from the other large groups. We meet quarterly, the major employers group, and the senior vets in those groups, we discuss and debate issues of common ground. I think the other thing that's opening up, though, is different career paths for vets, because in practice it very much was be an assistant or be a practice owner, and there wasn't much variability around that. There are new career paths opening up within all the groups, and I think that's a great thing for vets, whether that being postgraduate education, whether it be looking after our new graduate scheme, whether it be looking after our clinical advisory committees, all these different jobs that vets just didn't get to do in the past. These new roles, I think, are something that means that vets need to be prepared for this larger scale environment, and we need to be able to compete with the professionals from the other parts of the company that have been used to this for a long, long time in their particular jobs. I think the other thing is relocation. So it's not just the UK that this is happening to. As I mentioned, Scandinavia, Australia, New Zealand, North America. Mars, you probably saw recently, completed the purchase of VCA Antec. So they have 20% of the veterinary practice market in the US. It won't be long before Mars come knocking on the UK's door. So we will see internationalization of veterinary practice, globalization. I think another plus side is investment, because for some of these companies, depending on their model, then investment in the future is very important, and driving up the standards of infrastructure within veterinary practice in the UK. So clearly, some of the issues that are being debated in the profession at the moment are very important to the large groups. I don't know which way you voted in the referendum. Should we have a show? No, let's not have a show. But clearly, for the veterinary profession, Brexit is causing a huge headache. And I think well done to the Royal College and BVA for standing together and getting the message through. I've even heard Michael Gove mention the veterinary profession on Radio 4 a couple of times. So, something is getting through. You have to work hard to get Michael Gove to listen. But, it's a major headache for us. And I think it's probably useful that we delegated food safety and food hygiene in abattoirs to the Spanish vets many years ago. And that's going to help us, I think, in our arguments with government. But there's huge problems with recruitment out there. I think if we benchmark against the other groups, and I'm sure they do the same to us, but we're all running at around about 10 to 15% vacancies within our practices. There's a shortage of veterinarians out there. And there's a change in the workforce, of course, and that's been going on for 25 years or so. Student debt is a major issue. We've got a very expensive degree, and then the earning potential at the end is an issue, particularly if one is working part-time. So all these things, I think, are coming together and causing some serious headaches, I think, for not just the large group, but for the profession. Independent practice is suffering from all these issues too. But I think the large groups can help the sector get through some of this. I think another issue is veterinary nursing that the large groups are struggling with. And this is the image of veterinary nursing, of course, and it's a great job. But unfortunately, the reality very often is this: cleaning kennels. And I think we get a lot of attrition of nurses from the nursing profession. That's a great shame. If we think about human nursing and how that has changed, a friend of mine's a gastroenterologist up in Aintree near Liverpool, and his endoscopy clinic is run by nurses. So there's that poor fellow about to benefit from the expertise of that nurse in the endoscopy clinic. So I think the Royal College is doing this, but Schedule 3 needs to be looked at. I think we need to allow the veterinary nursing job to be more interesting and to be more technical. Now, I'm going to spend a little bit of time on this slide because it's a fellowship meeting, and many people in the room might be, maybe are specialists or have been down that route. And of course, this is the way that we think of career progression. It's a clinical career progression from new graduate to maybe, if we're going down the specialist route, intern or maybe a second internship, and then a residency, and then maybe waiting to pass the exam for a couple of years, maybe longer after the residency, and hopefully one day we might get to be a specialist. Now, if you look at the income of these people as they go through this progression, it doesn't look like progression to me. And I've been harking on about this for years, but I've got a serious problem with the profession and the way it treats young people in our profession. And you hear a lot about sacrifice. Well, I had to sacrifice everything to be a specialist. Well, okay, I don't mind sacrifice in terms of time and effort, but why should it also involve sacrifice in terms of income? Why don't we follow other professions and see progression as progression on all fronts? I think we've got a problem with that. I think we've also got a problem with the examinations in some of our areas. We've now got a European system, and I've been having some discussions with some of the colleges. One college, their first-time pass rate is around about 10%. So we're taking all these bright people, we're putting them through structured training programs. They come out the other end, they've lived in poverty for 3 to 5 years, and then we fail 90% of them. What sort of message is that? Look at those figures. We're failing those people. We're failing them in terms of either our supervision or the selection or the examination process, and I suspect it's the latter, and I suspect in some quarters there's a little bit of protectionism going on, and I don't think that's right. I told you I needed an exit strategy, didn't I? I also have a problem that the route to specialisation is very narrow, and it's very rigid, and I don't think it's particularly fit for the modern workforce, because I've met many people once have been out in the practice groups that we have who said, I would have loved to have been a specialist. I would have loved to have done a residency, but I had a family by then. I had a mortgage. I had a partner. And we don't facilitate those people to get through this process. And I think we need to be more flexible, more modular, and to help our bright, talented people come through. So I put a definition of a specialist up there, but I think you could also say they have to be young, lucky, and have independent means very often. I've recruited a lot of residents over the years in my academic career, and in many disciplines we get very few UK graduates applying. And I wonder why that is. I think it might be student debt. It might be that they just can't afford to drop back to that low income. That's Admiral Sir Philip Jones. He's the current First Sea Lord, or Phil as I like to call him. And I've known Phil for about 22 years. He grew up with my wife on the Wirral. He grew up in a very modest, semi-detached house in the shadow of Camel Ledge Shipyard, where his dad was an engineer. And I think it's testament to the Navy that it gives you faith in the system that the First Sea Lord can come from a background like that because he's a great leader. And I think we've got great leaders in our profession, but we don't necessarily nurture leadership enough or early enough in our veterinary curriculum. I know there's a lot of movement afoot to change that. That's Simon Innes, who's the CEO of my company, CVS. He's no relation to me. Well, maybe way back in the days of Robert the Bruce, who knows. But what joins those two people, well, actually, it's this. It's the Falklands War. When they were both young, Simon was in the army, obviously Phil was in the Navy. They both saw active service in the Falklands War. So the military is great at producing great leaders, and we need to be better as a profession in doing that. I'm not saying we need to go off to the horrors of war to do that. So I guess some of these things I'm saying relate to this. We've heard this phrase a lot in the profession, this leaky bucket that we have. Yes, we're training more vets, but we're losing a lot from the profession, and that's a big issue. It's a great shame. You know, all of us in this room dreamt of being a vet. It's been a privilege to be a vet. But many of our younger colleagues don't feel like that. They're leaving. So I think I've talked about specialisation because of the audience here today. Stephen May is going to fix everything, but Stephen's there because he's on the website, Royal College website, around the legislative review that's going on, and I think that's very welcome. And we have to understand millennials. I don't understand them. They're very different, aren't they, students? Yes. But, you know, we have to accept they don't necessarily want to put up with the things that we put up with. You know, children used to go down the coal mines, but they don't anymore. So, on that note, thank you very much for your attention.